with you, but along with everything else, it's definitely gonna be a tough one. So let's shift into another mode. Last week we had Lynn Cowles from Foundation Communities joining us, and she is joining us again this morning to talk more about Foundation Communities. Good morning. How you doing?
I'm doing so well. Thank you so much. I feel so lucky to be here with y'all 2 weeks in a row.
Lynn Cowles, you keep coming through like this, you're gonna get a nickname. L to the C, LC Boogie.
We're gonna put Lynn to work. That's right. Hey, wait a minute. I came over there for an interview. Next thing I know, I'm working for these dudes.
As those who don't know, she's very tall, so we may call her Treetop. I mean, I don't know.
Something like that.
She gonna get a nickname pretty soon.
Yeah, exactly. Yeah, I've never heard that. No tall jokes.
Death from above.
Yeah. How's the weather up there?
Yeah, exactly. Yeah. Well, cool. Well, Lynn, so tell us a little bit more about Foundation Communities, because I think we had some folks tune in. For those who didn't tune in, you can, if you would just give us more information, basically what we were talking about.
Yeah, definitely. So I am here to help promote the public health enrollment period. The public health enrollment period is a time when people who don't have health insurance from their employers, most people who don't have health insurance from their employers, or even some people who do because it's too expensive or maybe it's not good enough health insurance, when those folks can enroll in health plans that oftentimes are financially supported by the federal government through the IRS. So the enrollment period is a time when people who don't have those offers of employer coverage can fill out an application and pick a plan, and then the IRS will help them pay for that plan the same way that an employer helps people who are employed pay for their health insurance. So it just transfers the kind of like financial help from the employer over to the federal government, because the folks who enroll in public health insurance plans through what's called the health insurance marketplace, or at healthcare.gov, if anyone's ever been to that website. Because the employer they don't have an employer that helps them pay for their health insurance, the government helps them. And so that's what makes it affordable. So I'm here to advertise this enrollment period, which started back on November 1st and extends all the way through January 16th next year. But there is an important deadline in the middle of that. And the deadline is December 15th, which is coming up next week, next Friday. And so December 15th is the deadline when most people, not all people, but most people who want to have plans that start on January 1st of 2024. So you want to that new year comes and you want to get in the habit of, seeing your primary care doctor and getting a physical for the year, and maybe just getting that thing checked out that you hadn't gotten checked out in a while. For those people who are ready to get going and get started on January 1st, December 15th is usually the deadline for those folks to enroll in a plan. And then I'll be quiet in here in a second, but Foundation Communities is also a broadly serving nonprofit organization that has financial coaching for free, free tax help, bringing millions of dollars back into the Central Texas economy by helping people get as much money back as possible on their taxes. Tax season's coming up.
Yeah, it is.
Yeah.
Oh, goodness.
So, but anyway, the health enrollment period now, and then we also have a college and career hub. We have affordable housing. We have healthy living initiatives. So just generally an organization that wants to support financial health and physical health and community health in Central Texas and across Texas also.
Sounds good. Sounds good. Now we've got, I think the website is foundcom.org.
Yeah.
Okay.
Yeah,
Sounds
that's
good.
right.
So it's foundcom.org, and that's in the that's basically from there you can see housing, education, prosper financial programs, getting involved if you actually want to get involved with this as well. And the enrollment, it says open enrollment is from November 1st to January 16th, 2024. But then again, you mentioned also that there is a deadline coming up for December 15th. So y'all get on it. Yeah. I believe you had another question.
Yeah, I got some health there. I got to get into some hard hitting health care, cultural stuff.
Yeah.
Cultural stuff.
Totally.
So she didn't say she was a sociologist, but she's about to mesh medicine and sociology right here. So we're going to get to the culture of it.
Totally.
Lynn Cowles. Lynn, we come from a background where a lot of times things are passed down. There are home remedies. Now I'm gonna chase you on your hip hop culture here. There's a song called Grills, and it's by Nelly. And these are things that we get that are passed down. You see, you got me going to healthcare and spending all this money out there. This is where the lyrics come in. You see, my grandmama hate it, but my little mama love it. Home remedies versus healthcare.
Yeah.
Tell me why you're trying to tell me that I may have to give up my home remedies that grandma done passed down, and she says I do this.
Right.
You telling me I gotta go see Dr. Bob, who I don't even know?
Yeah.
You going up against grandma?
I'm never going up against grandma.
Okay,
Never.
okay.
Grandma is 100% right all of the time. Like all of the time. Yes.
Mix fixes everything.
And my grandma grandmamas aren't even alive anymore, but they are listening right now. So
Okay,
like, I know.
all right,
Yeah. Right. So absolutely both of these types of knowledge, the knowledge that the medical community has and the knowledge that communities pass down for generations.
Yes, ma'am.
In our grandmother's home remedies, in our healers remedies, in the family doctor who's been around for the last 40 years. Like the knowledge that community members have who are not medical doctors is so important at making sure that people are healthy. So what we recommend is that people have a health insurance plan for the things that are that you can't do when your grandmother wants to try to give you a salve or a treatment for a sore throat.
Yeah.
Absolutely, those things are necessary and important, and again, like just full of generations of knowledge passed down. So we keep those things and we do them.
Okay.
Yes, 100%. Also, it's important for people to have a health insurance plan so that in case there is a medical emergency, like we talked about appendicitis last week, right?
Yes, we did.
If your appendix bursts, like grandmama is not going to be able to help with that, right? But the hospital will. And so there's a way to like merge these two types of knowledge, these two types of medical practices into a healthy lifestyle. And it's definitely make sure that you are consulting with your family and your healers when you're not feeling well, and get the teas and drink the herbs and like get the helping family healing, the touch, that can help people heal so much. But then also get an annual physical, get your blood checked, get your cholesterol levels checked. So it's important to be able to do both of those types of things so that you have the kind of like the medical community's knowledge on one side, and then you also have that knowledge supplementing the family and traditional and community healing as well.
Lynn Cowles don't play. Y'all see what she did there? She said we gonna mix that.
Yeah.
We gonna mix. Since you want to talk hip hop, Dougie, she said we gonna mix. We gonna remix. I'm gonna play this beat and then I'm gonna throw this on top. So you're saying we could do a little herbal, and it doesn't have to be versus. It doesn't have to be herbal versus synthetic medicines.
Right.
You're saying we could blend all this together because you mentioned the herbs. So I appreciate that you are understanding.
Yeah,
okay.
totally.
Lynn
And
Cowles,
I'll go pick some holly leaves and make a tea out of those. Yeah, absolutely.
You ain't messing around. You got time for the one more?
I think we're gonna take a little break and come back. We're gonna take a little break and come back. More with Lynn Cowles from Foundation Communities here on the Morning Grind on FM KAZI. Lenny Kravitz been in the news because
maybe that's the radio nickname. We'll call you Lenny Kravitz, but it'll be Lenny Kravitz with the C instead of the K.
Lenny Kravitz.
Lynn. Is the middle initial E?
No, it's A.
Yeah. Lynn A. Kravitz. Lynn A. Kravitz. We'll get there.
Oh my God.
Okay, so
Lynn Cowles is what it said. Just incidentally, just letting y'all know.
Yeah.
So Lynn A.
He already started. Oh,
I need to know here.
Yeah.
I hit you with the other one. She side. She's too smooth, y'all. I'm gonna see if I can get her with this one. Help me. This one is not a catch you.
Sure.
This one is actually something educational.
Yeah.
So could you explain to me what are the differences between a copay and health co-insurance?
Yeah.
I don't know.
Yeah.
What is that? What are we talking about?
So this is these are complicated terms if you're encountering from the first time, but you over time it's totally possible to get it. So important to reach out to your local health navigators. Important to make sure that you have a guide through questions like this, so that you can work one-on-one with a health educator to know these things before you get into the doctor's office.
Yeah.
Again, just shout out to our program. Shout out to all navigators across Texas. There's 12 other navigator entities around the state.
Oh.
There's other organizations that don't necessarily get funded to do this nonprofit work, but we'd be happy to share their information with anybody who calls in if you're not from around the Central Texas area. You should always have your navigator's phone number in your phone to answer questions like this. What's a copay? What's co-insurance? So a copay is an amount of money that people pay to see the doctor. You pay it when you get there. You don't get billed for it, and it's an amount of money that people pay for a doctor before they reach their deductible. So health insurance plans have it's helpful to talk in terms of that makes sense to people. So it's like a chunk of money. This is a deductible. A deductible is a chunk of money that you have to drop into the health plan before the health insurance company will help you start paying for things. Oh. So like the way that the deductible generally works, not in all cases, is like if people will pay a higher monthly premium, then the insurance company will reply or respond by going, okay, you're paying us more per month. We'll drop your deductible so that we help you pay for things earlier on in your needs for medical care.
Yeah.
So you pay a higher premium, you have a lower deductible. Generally, it doesn't always work that way. But so the copay then is like an amount that the health insurance company says, okay, before you reach your deductible, maybe it's $2,000, maybe it's $4,000, whatever, you still need to see the doctor sometimes. So if a doctor's visit costs $300, then if your copay is 10, you pay 10 at the site of the doctor's visit, and then your health insurance company pays $290. So the copay is a way for people to go into the doctor's office, see the doctor before they have to meet their deductible.
Yeah.
And then there's coinsurance. Coinsurance usually is it's a split. It's a cost split between the insurance company and the individual, but rather than being a flat amount, like a copay, it's a percentage split. So, and it's usually after people meet their deductible. So, and say for instance, you have, and this is common, you have a copay to see a specialist doctor, and then that specialist doctor is like, oh, you know what? You need an MRI. We need to see what's going on inside your body. And so that MRI though is subject to the deductible, so you gotta drop that chunk of money first.
Yeah.
And then after you do that, then the coinsurance, we say it like kicks in basically, and then the insurance company pays for a portion of the rest of your healthcare after that. So if the specialist visit is $500, but your copay is $20, you pay $20, the insurance company pays $480. So that's your copay. And then say you need a $10,000 MRI. But your deductible is $2,000. So you drop your $2,000, and then you've met that for over the course of the year. You never have to meet your deductible more than once. Oh. So you meet the deductible, and then you still have $8,000 of MRI left to pay. And so if you're split with the health insurance company, is like, oh, I don't know, say 20-80. So 20% for you, 80% for the health insurance company. Then of that $8,000, you pay for 20% of it. That's your coinsurance, and then the insurance company pays for 80%, and that's their responsibility. So copay, in short, is pre-deductible. You pay it at the site. Coinsurance is after you meet your deductible, tends to be for services rather than doctor's visits, like MRIs, blood work, X-rays, that kind of thing, surgeries also. Yeah, and then and you get billed for that coinsurance, so you don't have to pay it at the spot.
Lynn be dropping that info.
Mad jewel.
Man, if I was walking around with this kind of knowledge, first of all, I'd be charging people. You'd call me Dr. Doug.
Yeah.
And then I'd have a line. I'd have a Cadillac though, Lynn. What you drive up in? You ain't got a Cadillac?
No, it's my friend Jenny's old Scion.
Oh, you doing it wrong. You're doing it wrong, Lynn.
She's a musician. It's a car for like DJs and musicians. It's like a very hip car.
Well, I appreciate you doing this for us, because I'm telling you, I would have a following. I'd be like, man, I'm Dr. Doug. Let me tell y'all how you gonna do this, because you breaking it down.
Yeah.
Maybe that's gonna be her. We'll call her Dr. Cowles. So we got a call.
Yeah, I think we got a call. Okay. Good morning, caller. How you doing? I think they're there.
Where'd they go?
Hello, caller. How you doing?
I'm fine. How you guys doing?
Hey, we're doing
good.
Great.
Doing
Hello.
Good. What's up, Miss Charlene? How are you?
I'm doing okay, Doug, and Javari, and your guest. I guess she's a guest, or she's a regular.
No, she's a guest.
She's a guest.
Lynn.
She's a guest.
Lynn
she's good
Cowles.
enough to be a regular.
Yeah.
It's Lynn Cowles from Foundation Communities.
Nice to meet you.
Okay. Nice meeting you, Charlene. Hey, well, look, Lynn Cowles, people have trouble paying their copay. People have trouble paying insurance. A monthly premium costs $400 a month. You think you're getting a good deductible, but it's not. We need to know the people's government, how these private insurers, what they receive from the people's government to put these expensive charges on us. And then you have in the plans where you can get 3 visits per year, and how many medications you can get, and a lot of them don't have specialists. So we paying out of our pocket, and then the IRS, I believe, stipulated that you have to fill an application to have insurance. These people can't afford insurance. So how do we get the system to recognize that they're ripping us off? And who's pocketing, who's served on the boards of these private insurers, and it's going into their pockets, but yet still we get no representation at the table, just like the people of the city of housing. How do we stop this mayhem? How do we keep our government accountable? How do we hold these private electors, private companies accountable? That's the same thing they're trying to do with the United States government, the people's government. They want to privatize Social Security and Medicaid. Why? It's going to be unaffordable for anybody to be able to have either some form of retirement, some form of income coming in, but yet and still they ripping the people's government off, the elected officials and the corporations, and yet we got Citizens United who sits up there. You think they're for the citizens. That's just a buku's a lie, but they're not representing the citizens. They're representing corporate America. So how do we, and my last comment, George DeSantis got expunged from the House of Congress. They locked the doors on him. Now we have Mike Johnson, the Speaker of the House. Do you know he's performing a cover-up right before the American people's eyes about the January 6th. What you call January 3rd?
Miss Charlene, I love you to death.
Yes.
I'm glad you called in, baby. We trying to stay close to time, and you had a question. You got to give her a chance to answer.
Yeah. She's
right.
not gonna be the January 6th.
Yeah, that's a whole
riot
different talk show.
All right. Well, we want the government to represent the little guy, and we need to have affordable insurance, and it's good insurance, just like it is for the rich.
Yeah.
Okay.
Yes,
Okay.
ma'am.
All right, then.
Thank
God
you.
be the glory.
Thank you, ma'am. Take care.
Well, and that is such important that's such an important insight. That's such important feedback.
Yeah.
Everything that she said is right.
Yeah.
We do have a privatized health insurance company or health insurance industry in the United States.
Yes.
Even the public dollars that help people pay for plans through healthcare.gov or through the health insurance marketplace, the public health law that we help people sign up for, people get those public dollars through their applications that we help them fill out to go to private health insurance companies. So all the plans that are available to people in Travis County, in all across Texas, in Tom Green County, in Williamson County, wherever you live, if the IRS is helping you pay for your health insurance, they're paying a private company. So they're paying Blue Cross Blue Shield, they're paying Ambetter, they're paying Oscar, they're paying Imperial, like whatever the health insurance company is, it's a private corporation. Sometimes they're publicly owned, but either way, it's private capital that's going into executives and administrators' pockets. So to answer your question, there's lots of types of health plans out there. And the ones that we help people get into are the ones that do not lack specialists. They do not lack medication coverage. They do not lack maternity care. There's this list of basic health things. They're called essential health benefits that every single plan that we help people enroll in has to meet the government's laws that determine what those essential health benefits are, and that health insurance companies have to have them and offer them to people. So none of the health insurance plans that we help people enroll in will ever not have a specialist that somebody can go see for diabetes, for muscular problems, for cardiac issues, right, for heart things. Basically, the government determines this list of specialist doctors that are necessary for all plans, and it requires all health insurance companies to cover all medically necessary things. So if you are on a plan that doesn't cover specialists or that doesn't cover medications or emergency room care or something, then it's not a plan that is governed by our American health laws, which means that it's probably what's called a limited benefits plan or a short-term plan, or it's a healthcare sharing organization that you bought into. And this happens a lot. Like, people will just go to the internet, or they'll call an insurance agent or a broker,
right,
and they'll say, I need affordable health insurance, what do I do?
Right.
And then the internet pops out a bunch of lists of companies, and some of those companies will have a plan for $20, and people sign on and they're like, oh, I have health insurance, but you don't have health insurance.
Right. I was going to ask you about that, because there's a lot of stuff out there. When people, go to Dr. Google.
Yeah.
And
Yeah.
and they go and they see, like there's certain websites where you can get quote unquote affordable health care insurance,
right,
and it's not
actual
covering
health
anything.
Yeah. And so those are, like I said, those are called limited benefits plans, short-term plans, healthcare sharing organizations, other kinds of plans, prescription assistance, primary care plans. All of these are massively limited, and they don't cover huge chunks of medical care that's medically necessary. So we recommend, again, call your local Navigator, call your nonprofit assister. Let them look at the plan that you have, that you thought was actual insurance, and we can help you figure out whether it is or it isn't. And if it's not, then we can help you fill out an application to see how affordable it might be if the IRS was helping you pay for what's called a qualified plan. And then very last thing, and then just to speak to your point, it's like, how can people avoid getting wrapped up in this system where they're paying so much, but they are feeling taken advantage of by their health insurance company? It's like, what we do is we help people use their plans to their best possible benefit. So if you're going to pay $20 per month for a plan and it's a qualified plan, or if you make more money and that plan costs you $120 per month, then we will help you use it. So you're getting every single benefit out of that plan, every single benefit out of that health insurance company, to make sure that you're not getting that you're not getting shafted by the insurance industry.
Lynn, you are killing it. I hope you need a raise. They need to give you all the time off that you want.
She needs a job in radio
because you're not talking over our listeners. You're personalizing it. You're taking calls. You're answering these questions. Some of these questions I've asked you, I know the answer, but I know other people may not know.
Yeah.
And yet you're still answering them, and you're probably like, oh, come on, I gotta do this.
No, that was such.
You're
a good
legit.
question. Yeah.
I wrote a song. Jabari and Dapper D, we talking healthcare with L to the C. Wednesday Mad is hump day on the fly. The morning grind talking KAZI. I mean,
Bars.
since you're gonna be here so often, we gonna have to. I'll put some music to that. We gonna do this thing. So I'm a little curious. We only have 5 minutes. Aww, we only have 5 minutes left with you, L to the C. And I was kind of curious about you guys and your flexibility. I thought that I had heard. So like, I know this lady Emily, right? So like, Emily has said that you and your team, of health educators, you may be able to visit neighborhood meetings, church groups, office settings, any place. Now, y'all all listeners, everybody can't get L to the C, but there's like other people on her team, and it sounds like your team of healthcare educators, y'all may come to the cookout. But if you don't make it to the cookout, y'all can come to the church meeting.
Totally. Yeah.
Really?
Oh, 100%. Yeah, and we will come to the cookout.
Well,
but also like,
I'll save you a plate.
Not very many. Yes, save me a plate.
Get
but
that
not
late.
very many people want to hear about health insurance at the cookout.
Yeah, it's true. Yeah, now we're eating the rib. You
Right.
You know your cholesterol can go up 18 points for eating that rib.
She's too smooth. She wouldn't do that.
Right.
Lynn wouldn't do that. She's like, hey, pass me a roll right quick.
Right. No, it's tact. Right. Just a little. Right.
And then later on, she might drop it.
Yeah, but thank you for bringing that up. We will visit with church groups, neighborhood associations. If you're just again like hanging out in your backyard with your family, we visit with school districts, groups of mental health care counselors. We want everybody to know that there are helpful health educators and health navigators around that can help people with these very specific questions. And sometimes if people if you're meeting with somebody who can help walk you through some of these things, like in a space that's already comfortable to you, because health questions can be they can remind people of bad experiences they've had in the past. They can be anxiety producing. They're definitely stress producing. So like because of those kind of like demanding moments when people are meeting with a navigator or with a health educator, it's really important for people to be in comfortable spaces. And so we'll come visit. We do health presentations at libraries, again for schools, for employer groups. If there's a small business out there and you don't offer health insurance to your employees, or if you're part of like a group of self-employed people who do similar work together, what have you, we would love to come out and just have a conversation about what health plans are available to you as folks who don't have employer health insurance, because having that opportunity to talk to an expert one-on-one means that people feel so much more comfortable when they sit down and look at that application, when they're getting to when they're picking a plan, and so we want to be as widely available to members of the community as possible to make sure that people can make informed decisions and feel good about their health care and their health coverage moving forward.
We didn't get to it, but Lynn, we're going to have you back next week. So listeners, we're going to have her back next week. We're going to take some calls. She wants to hear the good and the bad. We're going to do the bad first when you come, and then we'll finish that second half with the good stuff. So we're going to have to screen them calls, and we want to hear the good stuff on there. But one of the things we're going to talk about then is you were telling us that there's a stat. There's a stat that your team gave us. At 18%, uninsured Black working age adults in Texas have a much higher chance of being uninsured than white community members. We're going to get into that next week. And one thing I wanted to offer on that is I wanted to offer you, so you can get your homework so you'll be ready. With a history of abuse in American medicine, Black patients struggle for equal access, and we have a lot of apprehension. So we're going to get into that topic.
Perfect.
Next week. Yeah. So that. Hey, I want to leave them. I want to leave them hanging. I want to leave some meat out there and let them know we're gonna get to that stuff.
Tune in next week.
Yes.
That's actually a really good topic.
So L to the C, if she shows up, because she ain't showing up now.
Be here.
You gonna be here?
I will be here.
I didn't scare you. Her heart don't pump no Kool-Aid.
No, man. No,
she said I'm here.
I'll
be here.
That's pure blood right there.
She ready?
Yes, sir. Yes, sir.
L L to the C stays
to the
ready.
C.
L to the
LC.
C. I like it. Yeah.
Well, L to the C from Foundation Communities. We certainly appreciate you being on and look forward to having you again next week.
Awesome.
When we take those calls. And man, I think that's just an excellent idea, brother.
Yeah.
Excellent idea. In the meantime, you can go to foundcom.org. I say the com and the org because we always say com.
I know.
That's
Yes.
Yeah.
So foundcom.org, that is the website for Foundation Communities. Get linked in, check it out, and hopefully it's something that you can use for your life. We'll be back with more on 88.7 KAZ.